What the heck is GERD? Well, it's gastroesophageal reflux disease. So why am I talking to you about acid reflux and GERD? Well, first of all, let me explain something. I'm a cardiothoracic surgeon. And what that means is I operate on the heart, cardio, but I also operate on the thorax. And in the thorax are the lungs and the esophagus, the swallowing tube. And part of what I did as a practicing surgeon was treat patients with acid reflux, with heartburn. Now, I did it at the last resort with operations that we used to fix this problem. But more importantly, a job of any surgeon is to try and alleviate the problem before resulting to surgery, believe it or not. In fact, as most of you know, I decided to stop being a heart surgeon because I could, with food and supplements, prevent the occurrence of heart disease or reverse heart disease in my patients. And I felt that was a far better use of my time. So I know a lot about acid reflux and GERD. So what is it? How does it occur? And what can we do about it? So the conventional wisdom is that acid reflux, or GERD, occurs when stomach acid, which is very caustic, leaks from the stomach back up into the esophagus. And unlike the stomach lining, the esophagus has a less tough barrier against acid. And so that acid, which refluxes, goes backwards up the esophagus, burns the esophagus. Now, that burning can be felt as pain. Interestingly, the same nerves that innervate the esophagus go to the same center of the brain as the nerves that innervate the heart, the pain nerves. And we used to joke long ago, back in the 1960s and 70s, that half the people that we operated on for reflux actually had heart angina. And half the people we operated on for angina, heart pain, actually had reflux because they couldn't tell the difference. And back before really good cardiac catheterization and really good reflux studies, we often couldn't tell the difference. And to this day, many people with acid reflux or GERD get a feeling of crushing chest pain. Some people even get feelings of achiness in their left shoulder or even down their left arm, and rightfully assume they're having angina or even having a heart attack, when it actually is the reflux. Why shouldn't we have reflux in the first place? Well, we have a valve, a one-way trapdoor at the bottom of our esophagus. It's called the gastroesophageal sphincter. Sphincter tightens. Every time we swallow, food's supposed to go through that opening, and then the opening's supposed to close. And that normally would prevent anything from down in the stomach, think of it as a washing machine, from leaking back up into the esophagus. Unfortunately, there's a number of foods that can cause that sphincter to not work very well. And they're some of the ones that you associate with heartburn. First of all, alcohol is really good at kind of temporarily paralyzing that sphincter. Chocolate is well known for loosening that sphincter. Those are two of the biggies. Spicy foods like peppers are well known for loosening that sphincter. And those are some of the foods that we associate with, quote, heartburn. Now, reflux in itself, if it just happens and then things flow back into the stomach, isn't necessarily going to cause any long-term damage. But reflux, which happens nearly constantly, can cause really mischievous inflammation and damage to the lower esophagus. Reflux, if it's bad enough, can actually come all the way up the esophagus and spill over into our lungs, particularly while we're sleeping. And some people, their presentation of reflux, which they may not feel as pain, can actually be from a chronic cough at night or even hoarseness from damage to the vocal cords by the reflux. The first things we do for acid reflux, for chronic acid reflux, is, quite frankly, eliminate the foods that are responsible for that lower esophageal sphincter loosening up. And for a great number of people, that solves the problem. But the other problem is that pressure in the abdominal contents, pressure from the gut, can actually allow less room for the stomach to expand after you've eaten. And that pressure, even with a pretty good sphincter, is able to overcome that sphincter and push things back up. And one of the fascinating things that my patients find when we put them on a weight loss program is that their GERD miraculously disappears. And that's because we've lowered the pressure in the abdomen. One easy trick that I have all my patients do is that if we have them sleep on their left side, the entrance to the stomach is actually near the right side of the stomach. And so if we have people sleep on their left side, it's much more difficult for stomach contents to reach up to where the esophagus is. On the other hand, when people sleep on their right side, it's a direct shot up the esophagus from the stomach. The stomach can empty right into the esophagus. So the first thing we do is put people on pillows, or even you can buy them on the internet, to force you to sleep on your side, on your left side. And that often works. Now, one of the things we learned early on in treating this is the last thing you want to do is you want to get a bed that folds like this. Because what we learned is that the fold of the bed actually increases pressure in your gut. And rather than helping, it actually makes things worse. And in the good old days, what we would do is we'd send people to the hardware store and we'd have them buy 2 cinder blocks, 2 cement blocks, and we'd put them under the head of the bed, and they would sleep like this. And that's very effective. Now, the problem is you tend to slide off the bottom of the bed. So a lot of patients, we had to have them put a footboard, very much like a Pilates reformer, on the end of their bed. Now, most of this happened to men, but those are the standard treatments for acid reflux. Now, there are some severe forms of acid reflux, or GERD, which causes so much damage to the esophagus that we either get scarring or we get a pre-esophageal cancerous lesion called Barrett's esophagus. The traditional treatment is using PPIs, proton pump inhibitors. These are antacid drugs. Antacids absorb acid, but antacid drugs, like proton pump inhibitors, like Nexium or Prilosec, actually stop stomach acid production. And the original theory was it was the acid that was the problem. And they are effective. However, if you've read any of my books, you know that stomach acid is incredibly important. It's incredibly important to prevent bad bacteria from getting into your gut. It's incredibly important for digesting proteins. And proteins have to have acid to be digested. But what's really interesting is acid is very useful for keeping bacteria that live way down in the colon from coming up into the small intestine, where they're not supposed to be. And if you've heard about the epidemic of SIBO, small intestinal bacterial overgrowth, a lot of the contribution to everybody on Prilosec or Nexium is they're getting SIBO because bacteria are no longer contained where they're supposed to be by acid in the stomach. We've learned that these acid-reducing drugs actually work by paralyzing mitochondria. They are proton pump inhibitors. And mitochondria work by pumping proteins. What we didn't realize is that we now know there is a significant association with these acid-reducing drugs and the development of memory loss and dementia. Because what happens in the stomach doesn't just stay in the stomach. Proton pump inhibitors work on all protein pumps, including our mitochondria. And your brain is loaded with mitochondria trying to produce energy. So the answer to acid reflux is not one of these drugs. So why does Larry the Cable Guy have Prilosec OTC so he can have a corn dog? Let me take you back in history. I grew up in Omaha, Nebraska, which at that time was claimed to fame was the world's largest cattle stock market, where we would take cattle and put them in pens and keep them from moving around, and we would feed them corn and soybeans. They got so much heartburn from the lectins in the corn and soybeans that they refused to eat. Now think about it. If something you were eating caused pain in your chest, and you were a smart animal, you'd probably stop eating that thing. The pain that Larry the Cable Guy got in his chest from eating a corn dog should have stopped him from eating it. Instead, he took a Prilosec OTC. So what did we do in Omaha? Believe it or not, a third of all the calcium carbonate in America produced, that's Tums, is mixed into cattle food. So they wouldn't get acid damage to their esophagus from eating the lectins in corn and soybeans. That's what Larry the Cable Guy was basically doing. Now, why am I telling you this? Because I used to eat Tums and Rolaids for breakfast, lunch, and dinner. I would travel with them because I had really bad heartburn. Imagine my surprise when I eliminated most lectin-containing foods from my diet and my heartburn went away because I was no longer irritating my esophagus with lectins. And what's really remarkable and pleasing to me is we've had a number of patients with biopsy-proven Barrett's esophagus who we don't use the acid-reducing drugs, but we put them on a lectin-limited diet, and their Barrett's esophagus has resolved. Now, I am not your personal physician, and please listen to your personal physician. But I am telling you from a nutritionist standpoint that this system works, and it certainly, to whatever your physician recommends, should be added to your treatment of acid reflux and GERD. Now, lastly, we know of not an insignificant number of people who are put on acid-reducing drugs, and yet they still have reflux. And it's no longer from acid, but it's actually from bile. It is still, in some people, useful to resort to an operation, either through the chest or through the belly, now done endoscopically, laparoscopically, with minimally invasive surgery. And that is the last resort. But acid reflux is a real thing. I absolutely see it in my patients. I see it resolve in my patients when we combine a lectin-limited diet with appropriate weight reduction, particularly belly fat reduction. And so that's why you see all these GERD commercials. That's why you see acid reflux commercials, because it's a huge problem, but the problem is not solved by what you see on TV.